And so the systems approach that was adopted at the Cotswold Community very much influenced the way that I took work into healthcare management.
Yeah.
And to some extent in international health as well, in that I worked very much on national disease programs around the world. And one needed to, you knew that for a country to be effective in, for instance, their program for HIV or TB or whatever, needed to not just look at the delivery process of drugs. You need to look at the supply system all the way through. You need to look at the legal system that they're operating in the country. You need to look at the messages that the elders, the community thought leaders, like the religious leaders, that they are sending in the community. So you need to take a total systems approach. So I think that that initial grounding that I experienced in the Cotswolds to a systems approach was, for me, extremely valuable.
Yeah. And my understanding of how that looked in the Cotswold community is that everyone, all the staff were trained in the model. All the staff were responsible for the delivery of the model.
Yes,
And
that's true.
yeah, and as an example of where that can break down, I remember John Whitwell talking about once he'd moved from the Cotswold to the first therapeutic foster care service within the UK. He made a similar point in relation to the drivers that they relied upon to transport young people to school and so on, and that the observation that when the drivers were out of sync or asynchronous with other endeavour, that that has a observable impact on your capacity to achieve the outcomes of your endeavours.
Yes.
Yeah. And you moved into international healthcare management and consultancy. What kind of motivated you to go there?
Well, I guess it was that original interest of mine in the concept of human capital, but very much on a macro scale.
Yeah.
Where I was looking at what was happening in whole countries, not just in local communities or individuals, and also the knowledge, and this is what we see in this field of treatment for disturbed children. The knowledge that many of these interventions are massively cost effective. When I hear politicians drumming on about, we've got to increase productivity, there is just so much that we can do as a society that is massively cost effective.
Yeah.
Rather than, well, you would know in dealing with disturbed children, rather than locking them up in very, very costly and very destructive warehousing facilities where they are not going to really gain anything at all. But if we do invest in them, hopefully very early in the piece, well before they become, disturbed adolescents, but very early in the piece, the paybacks are enormous.
Even so, if they're disturbed adolescents, because the example you gave of the young person, now not a young person anymore, who contacted you, I mean, think of the savings to society in the way and the breaking of that cycle and the way in which his family life and his and his children being at university, where the alternative would be to repeat the troubles that family had, and there is a massive cost to society.
Indeed.
So,
yep.
yeah. So the Cotswold
in those fields that I was working in like in TB, I've seen various studies that suggest that for each dollar that's put into a TB program, society gets $42 back. Similarly in malaria and HIV, not at that level. But I've seen figures of around $20 to the one. Phenomenal payback, and I'm sure that there are similar studies in the area of treatment of young children.